So I wanted to jump in here and I've got about 30 minutes to answer some questions on all things Social Security and Medicare and Medicaid. If you're new to my channel, I'm a retired district manager of the Social Security Administration. Before that, I worked for the Department of Social Services many moons ago. I was a sergeant in the Marine Corps, so pretty much spent my entire life with inside the bureaucratic beast. So I do a live Q&A twice a week, and as you can see, I pop up every now and then like I'm doing right now and answer some questions. I've also got hundreds of videos on my YouTube channel that you can go in there about all things survivor benefits, spouse benefits, disability, retirement, Medicaid, Medicare, all of it. So make sure you check out all my videos. And if you don't have a question today, make sure you subscribe, because invariably what happens is people contact me and they say, oh yeah, I saw you a few months ago and I didn't have a question. Then I did have a question. I couldn't find you again. So if you subscribe, then you can find me in the future. All right. So if everybody that's live, please press like and type your questions in the chat there, and I will answer as many questions as I can in the next 30 minutes or so. I've got a regularly scheduled live tomorrow, Thursday, and we're going to be talking about a bunch of things that people are surprised Medicare covers. And then on my regular Thursday, I do, again, a topic on my regularly scheduled lives. I do a topic and then I open it up to any questions that anybody has. All right. So if anybody, I did another impromptu live yesterday for about an hour and a half. It was longer than I thought it'd be. An hour and a half, and I still didn't answer all the questions. That's why I figured I'd jump in here today and answer maybe hopefully the people that were here yesterday and weren't able to get their questions answered. Maybe I can get their questions. And I am officially, I think, broadcasting now on LinkedIn. So I'm doing a live on LinkedIn. I've added LinkedIn. I'm just trying to get the out here. Okay, all right, here we go. Do I have to get Part C? My camera for TikTok is not acting right here. I'm all over the place. All right, sorry about that. All right, no, you do not have to get Part C. So Medicare has Part A that covers your hospitals, Part B that covers your doctors. Part C is what they call the Medicare Advantage plans, and those are administered and run by private companies. And then you got Part D, which is the prescription drug plans. So Part C is Medicare Advantage. It's used to call kind of a Medicare replacement. So you're kind of, for all intents and purposes, giving up original Medicare Part A and Part B, and then going to a private company. There are, with everything in life, there are negatives. Part C, the Medicare Advantage plans, they, have pre-authorizations that if the doctor says you need X, Y, or Z, the insurance company sometimes, has to pre-authorize whatever the doctor says. And there's networks for Medicare Advantage plans, but a lot of them are zero premium, and they offer some extra benefits depending on what part of the country you are. And so, yeah, you don't have to get Part C. The other alternative to a Medicare Advantage, so because you definitely don't want Medicare alone, Part A or Part B, unless you got a few $1 million in the bank. Because, for instance, Part B has a 20% deductible. So doctor gives you a surgery or a $100,000 Band-Aid, then, you have to come out of pocket with $20,000 cash. So that's why a lot of people get some type of supplement, either a Medicare Advantage or a Medicare supplement. It used to be called a Medigap. And those are the ones with the letters of Plan G or a Plan N are the ones that people are getting nowadays. And I've got a bunch of videos on those. I recommend Medicare supplements if it's in your budget. I think over the long term, it's probably cheaper if you actually get sicker, if you actually get sick. Yeah, if you need help, I put together, because, Social Security alone, Medicare alone is great, highly support it. We all should support it. So it'll be here for our kids and grandkids. But having Social Security alone and Medicare alone definitely is not going to do it. So you need other things. And that's exactly why I put together a network of partners throughout the country that can help with all things Medicare supplements, Medicare Advantage, life insurance, burial insurance, vision, dental, and stuff like that. And so you can just call our number 888-817-0446, or just type in MyGovExpert and you'll see the phone number and email, or just email me at ed@mygovexpert and then tell me what you need. And then we'll find someone that in your neck of the woods that that can help you navigate all of that, and they don't charge anything for that service. So, and full disclosure, they support our channel, so they support our ability to do what we're doing here today. Does Part C cover your meds? Yes, they can. For the most part, they're bundled. So when you get a Medicare Advantage Part C, then most 95% of those plans cover prescription drugs in there. They're bundled in there. Some of them don't, because some people don't want prescription drugs in there, because usually it's people that are veterans and they have prescription drugs from the Veterans Administration. So people, so they don't want, they don't want prescription drugs. So they just get a Part C without prescription drugs. What is the best Medigap? Well, it really depends on a particular situation. They're all the same in the sense of Plan G is a Plan G is a Plan G, whether you get it from company X, Y, Z, D, or F. Plan N is Plan N, unless it doesn't matter what company you get it from. It's all based on price. There's a couple of, some are starting to add like gym membership and telehealth and stuff like that. But for the most part, they're all pretty much the same. And if you watch my videos, I've got a few videos on that. I prefer Plan N because I'm cheap and I like to save as much money as possible. And I think going forward in the future, Plan N, the rates are going to rise less than the Plan G. But Plan G is easier to understand, so that's why a lot of people, recommend Plan G, because it's just so easy to understand. But I'd rather spend another hour and save a whole bunch of money throughout my life. So there's that. But watch my videos on that, and then if you want to get a quote on the plans available in your area, again, call my number. I put it up on the screen for Facebook, but I can't do TikTok. Everybody, please subscribe to my TikTok. I can't do TikTok. I can't do all the fancy stuff on TikTok yet because I don't have 10,000 subscribers. So as soon as I get 10,000 subscribers, then I'll be able to put all kinds of, my phone number and, show you different things on websites and all that kind of stuff. So I need 10,000 subscribers to do live correctly. So please. All right, let's see what else we got here. Wendy. Hey, Wendy, what's up? How you doing? Let's see. Kimberly, yes. No, Kimberly, we need to talk about your son. As you can see, I've been going a different route rather than helping a dozen people a day, like I did last year. With this new system, I'm able to help thousands of people a day. But in your case, I really need to talk to you. So Do me a favor, send me an email. That's the best way to get a hold of me, ed@mygovexpert.com. Send me an email today, and it's about 3 o'clock-ish, and I will 100%. So send me an email with your phone number, and I will call you back within an hour. Okay? I guarantee it. I guarantee it. All right. Hey, Nancy. Good afternoon. How you doing? Welcome. Welcome. Susan. Let's see. This guy is supposed to be connected to the Social Security Administration. No, I retired. If you ask the Social Security Administration about this man, they don't know who he is. Figure that out. No, well, yeah, there's, 65,000 employees, and yeah, not everybody knows who I am, but most people on the West Coast know who I am. And you can just Google me. There's a website where you can see federal employees, and it still has my information in there as GS14 with the Social Security Administration, and I've got pictures with all the commissioners and yada yada yada. You can go onto the website I had. I think it's still up there. Is eweir.org, and you can see some of the pictures of my office and stuff like that. So yeah, Susan, a little bit of conspiracy theory there. Mary, working full-time, 67 years old, no Social Security or Medicare yet. Had bad car accident. Oh, sorry to hear that. Out of work for 9 months, recovering. Had to be on COBRA for part-time. They kept my job and went back to work. Yeah, but you're 67 years old, so if you have, well, COBRA doesn't count as credible coverage. So if that's all you've had in the last couple of years, then you might have to pay a penalty for Part B. So I don't know if you have health insurance now since you've gone back to work. If you have, then that's good. But that COBRA is concerning. And you're 67 years old, so you can actually start collecting Social Security benefits because you're obviously past your full retirement age. You can collect your Social Security benefits and continue to work. So let's see here. Unless you want to wait until 70, because you get delayed retirement credits up until 70, but definitely don't wait till after 70 because it doesn't increase. It increased basis on COLA and stuff like that, but so 70, yeah. Let's see here. Was on COBRA, will I be penalized? Yes, COBRA is not. In order to prevent the penalty, it has to be coverage from current work, either your current work or your spouse's current work. So, and please, everybody, share and like and subscribe and all that kind of good stuff. We need to get information out there. I'm going to be doing a video and in the next couple of weeks on I need your help to improve the customer service of Social Security. And again, I ran the third busiest office in the country, and my office was one of the most efficient offices in the country. And I used to go to the other offices and teach them the secret to our soup. But I want to do that again for all the new district managers out there. And I need your help to improve customer service because, there's over 1,500 offices throughout the country and they need your help. It's a political issue. Politics is all about resource management. Now it seems like politics is all about calling each other un-American and evil and the devil and communist and fascist but no, politics, this is, yeah, it's, so I'm going to make a video on that. And so please subscribe so you get that. And we're going to need your help. And then once Social Security customer service gets to a good place and they actually pick up the phone and there's no long waits and all that kind of stuff, then I can go back into retirement again. And yeah, so there's that. Let's see. Let's see. Any other questions? Everybody, please press like here. Let's see if I have any questions on Facebook or LinkedIn. I'm always hesitant about Facebook. I always get all kinds of weird conspiracy theories on Facebook. But yeah, there's that. All right. Not that many questions out there. There was a question yesterday that I've gotten a couple of times about deeming. So there's a couple of deeming. There's deeming in terms of spouse benefits that you have to file for benefits on your own record. And then if your higher earning spouse earns twice as, or benefit amount, their PIA, their benefit at their full retirement age, is twice as much as yours, you're entitled to spouse benefits, but you have to file on your own first. So it's called a deemed spouse, a deemed filing. But I think this person was asking about SSI, and SSI is the welfare-based program. So there's SSI, Supplemental Security Income, and then there's SSDI, Social Security Disability Insurance. So SSI, because it's a needs-based, welfare-based, low-income, low-resources program, Social Security obviously wants to make sure you don't have a few $1 million in the bank and a bunch of income coming in. So they do a lot of weird calculations, and it's very difficult. And one of those things is called deeming. I'll have to put a chart up. There's a chart on the Social Security website, and it goes into all of it. And it's basically if you are, in order to get SSI, either two things have to be met. You're either disabled or you're aged, 65 and older, low income and everything, and you don't have, over $943 from regular Social Security. Then income that is coming into your household. So if you're married and you have a spouse, that spouse's income is deemed as your income. When you get married, for richer or poorer, for till death do us part and all that kind of stuff. So Social Security says, okay, sure, that's not your income, but you're married to this person and that person's income. So we assume because you're married that person's income is helping you live. And therefore we are going to deem part of those earnings, whether they're work earnings, earned income, or unearned income, to you. So if you're married and you go file for SSI and your spouse makes $4,000 a month, then guess what? You're not going to get SSI, and you're going to say, "But I'm not working. I don't. I'm poverty level." Yeah, but you're married. But there are millions of different variations. Okay, I'm married but separated. This is not earned income, it's unearned income, and it's because of this, and there's all kinds of different variables. And you've got kids in the house that some are eligible for SSI, and then there's ineligible children that are not receiving SSI. To do the calculations on SSI is a nightmare. I've hired many people when I worked at Social Security, when I ran my Social Security office. I've hired many people, and when you hire them, you pick what they're going to be. Are they going to be doing retirement and SSDI and survivor benefits or spouse benefits, or are they going to do SSI? And it really depends what we needed in the office. And if we needed SSI employees, then we would say, guess what, you're SSI. And some of my employees always held it against me that I hired them as SSI claims specialist, and they're like, "Oh, I wish I was on the other. Why did you put me in this, Ed?" Oh, so if my employees are out there watching, hi Stephanie, I apologize. She used to harass me about it continuously. So there's that. All right, so that's deeming, SSI deeming. I might have to do a video on it, but it's one of those things that is so complicated. Even if I did a video, it would, it's just report your earnings, answer the questions that the SSI claim specialist asks, and yeah, and let them do the nightmare calculations. So. Disabled officer, hi Ed, I sent in my overpayment over 3 weeks ago and haven't heard anything. Is this normal? Yes, absolutely. Well, you sent in your overpayment. What does that mean? You sent in the check to pay for the overpayment, or did you send in the request for the 632 to request the waiver or to renegotiate? But regardless of whatever the case, yeah, 3 weeks is still, unfortunately, yeah, that's normal-ish. But yes. Yeah, that's another issue with Social Security is they have this system called Work Track, and they have each office has up to 30 days to work those things. Anything over 30 days, then the higher up office says, hey, how come you're not addressing these issues? It's over 30 days old, and yada yada yada. I think it should be 15 days, but yeah, so yeah, 3 weeks is, unfortunately. That's why I'm doing this video in the next few weeks about how we can. I'm going to give some suggestions on offices on how to improve customer service, but I'm going to give some suggestions on how we. So every time you hear somebody complain about customer service, about Social Security customer service, about them not picking up the phone and about long lines or whatever like that, then you're going to say, well, okay, what did you do to solve that? It's like everybody complains about the weather, but nobody does anything about it. So everybody complains about Social Security, doesn't know anything about it. And I'm going to show you how to do something about it when I finish this video. So, all right, let's see if, please share and like. What alphabet letter Medicare supplement plan do you recommend? Again, it's a personal decision, but personally, I prefer Plan N as in Nancy. So, I mean, it's Plan N as in Nancy is right there, and then Plan G is right below it, and then Medicare Advantage is like way down here. Again, I have a problem with, Medicare Advantage. Yes, there is a lot that you could criticize Medicare Advantage plans about, how they're administered and everything, but they are the reality, and there are unfortunately a lot of people out there that can't afford the monthly premium for a Medicare supplement plan, and they know they should probably get a Medicare supplement plan, but they just can't afford it. So you get all these YouTubers and commenters and that just want to harass people for picking a Medicare Advantage and about the whole thing, and making people feel bad about their decision. And so you educate people, but if it's just not in their cards, it's not in their budgets, then it's just not in their budget. Don't make them feel bad about it. Go out there and try to fix the system rather than so yeah, that's my 2 cents. Nancy, I chose Plan N as in Nancy. Yes, awesome. Yes, awesome. Good deal. Yeah, there's G covers everything original Medicare Part A and Part B does, and it fills in all the gaps, the 6 gaps, except for the deductibles, the one-time $240 deductible, one time a year. So if you go in for surgery and your surgery is $1 million, you pay $240. It's a beautiful thing. Plan N doesn't cover that, $240. Plus but it does. The other things it doesn't cover is if you go see a doctor, they could charge you up to $20. Usually it's about $14 a visit, but it's only on your initial visit. If you go like to physical therapy 3 times a week, it won't be $20, $20, $20. And if you go to emergency room, they'll charge you up to $50. And there's excess charges. Some doctors, not many, only a few % of doctors and hospitals throughout the country don't take Medicare rates, don't accept Medicare rates. They want to charge a little bit extra, and they can charge up to 15% extra, but 90% plus don't, and some states don't even allow excess charges. And so with an N, you can save, every month to pay for the, $20. And so and because G is easier to get into than N, G is everybody, including myself, believe in the future the rates on G are going to go up quicker than N, because N is more difficult to get in. Once you turn 65 or you just stopped receiving health insurance from work, you can get N, G, no problem whatsoever. But for a bunch of other situations, N is a little bit more difficult and a lot more selective, and health insurance is a pooled risk and all that kind of good stuff. So yeah, N, yes, but G, either one of those is perfect. And again, call my number, email me, and I can find someone in your neck of the woods to kind of plan, because there's G's, but there's probably a dozen, 24 companies in your area that are offering G's, and then so the person can give you some quotes, find you the best one for you, and then you also need to sign up for Part D, the prescription drug plan, and if you want dental and vision, all that kind of good stuff too. Vicky, I'm clergy, 58, and have all my credits. My income has been very low. My husband is 15 years older than me and has stage 4 cancer. So sorry to hear that. I will claim on his record. Okay, so yeah, so you have to file on your own, and then you can file a spouse benefit, unless it is a survivor. If for survivor benefits, you can file for survivor and let your own, continue to increase. But if you're clergy and low income, then yours will never, I'm assuming, will probably never be more than a survivor benefit. So you just stay on that one forever. The $50 copay for Plan N is if you are not admitted to the hospital via the ER. If you are admitted to the hospital, then the $50 copay is waived. Yes. All right, Jennifer, thank you very much. Yes, absolutely. Yes. If you're if you go to emergency room and they admit you from the emergency room, then you have to pay the $50. It's a beautiful thing. Awesome. Good job. Barbara, what is the big deal about Medicare Advantage plan? I have it and don't understand why you don't like it. I have been blessed having it. What should I know? I will be 66 next month. No, it's just the networks, and the networks are always changing. But if your primary care physician is in whatever network, and that's the plan that you have, and they intend to stay in that network, you're good. The pre-authorizations, but Congress is kind of coming down on those. There are some companies out there that used algorithms to deny people. How it should be is your doctor says, okay, you need this. And then the doctor has to get permission from the insurance company to do this, whatever it is. Medicare supplements, they don't. Insurance company has no say whatsoever. If the doctor says you need it, done, end of story. If it's covered by Medicare. It's one of those things that if it's covered by Medicare, if you have like a mole on your face and you say, I just don't like the mole on my face, I want to get it removed. And they say, well, sorry, it's not covered. But if they say, if you have a mole on my face and I think it might be cancerous, then it's covered, type of thing. So, so cosmetic type things aren't covered by Medicare. But Medicare Advantage, they have the pre-authorization. So the algorithms that some company were using, a doctor in the insurance company, they're actually supposed to have, someone official, that knows about medicine, look at the case and approve it or deny it, or ask for more evidence, or whatever the case may be. But some companies out there, I'm sure you'll see, all you gotta do is Google, and there's a bunch of, stories out there some companies out there were using computer algorithms to just, just deny people without anybody actually looking at them. So that is the pre-authorization. And it sounds like you haven't had those issues and yet, and everything is good and awesome. Medicare Advantage, if a lot of those are zero premium per month, and they've got all the extra bells and whistles, depending on what part of the country you're in. And if you're, healthy and you never get sick or have an accident for the next 75 years, and then just die one day, pass out, whatever. And then, yeah, Medicare Advantage was definitely the way to go. Yeah. But, we don't necessarily know that. So yeah, Medicare Advantage, like I said, they are an option. Yeah. Hannibal, my fiance American, she is with me now in Tunisia, and all of her family hate me because I'm from a different country. They raised, okay, all right. All right, so we've got an interesting someone from Tunisia. All right. All right, we've got a bunch of political stuff on TikTok. Any chance getting Medicare? Okay, any chance of getting a Medigap policy at age 60 on SSDI? It really depends on your state. So if you have Medicare, you can get Medicare based on being 65, or you can get Medicare based on being on disability for 2 years. Okay, but it depends on your state. Again, so call the best way to on TikTok, because I don't have 10,000 subscribers, I can't put my phone number and all that kind of cool stuff up there. But so everybody subscribe. But yeah, so just type in, was it the little sign MyGovExpert, and you'll see me pop up all over the internet. But it depends on your state. Some states mandate insurance companies to offer Medicare supplement plans to people on disability under 65. And some states do not. And some states mandate companies to offer them, but they don't restrict how much they charge or what plans. So it's unfortunately, it's all the states are all kind of strange. So you've got one state that, no, you're under 65, you can't do it. No, you're out of luck. The only thing you can do is Medicare Advantage. And then you've got other states that say, oh yeah, you can do a Medicare supplement, but it's going to cost you 5 times, 3 or 4 or 5 times what it you do at 65. And that's another thing is, so if you go ahead and, again, you don't have someone to help you out with this, again, call us. And if you don't have, if you can't get a Medicare supplement in your state, and all you can get is Medicare Advantage, go ahead and get that, because that's, covers all the gaps, most of the gaps. And when you do turn 65, then you can switch to a Medicare supplement and nobody can deny you. So it doesn't matter what your pre-existing conditions or what you had before. And that's another thing that, a lot of people, it depends on your state. If you're able to get a Medicare supplement and you're paying 3 or 4 times the amount, yeah, people have contacted me and says, yeah, I'm 67 years old and, I'm paying 3 times because I got it when I was disability. No, you should have switched when you turned 65. So yeah, you can switch to a lower rate and nobody can deny you. Did I skip a question? Let's see here. Dun, dun, dun. I'm going back. Nancy. Karen. Oh yeah, I did. I'm sorry, Karen. I will be 67 tomorrow. Happy birthday. I reached my FRA on October 23. I have a telephone interview on May to start my Social Security. Can I request my monthly payment starting with October till present? Yes, because you're after your FRA, you can go up to 6 months back pay. So yes, definitely. And it also depends when you call them. and all kinds of issues like that. But yes, absolutely, Karen. When you call them up and say, hey, I want as much back pay, I want my, start my benefits in October, because after I called you last month, or, I'm past my full retirement age, or whatever the case may be. So yes, absolutely. And then the first check, you'll get a nice little chunk of change in the first check. Yep, it's a beautiful thing. Barbara, okay, thanks. Not yet. Yes, I haven't been sick, although I am in the process of seeing hearing aids. I was told Medicare and neither Medicaid will not pay for it. Yeah, hearing aids, Medicare Advantage. That's one of the good things about Medicare Advantage plans. Some of them do cover hearing aids, and some of them are. Yeah, so it really depends on which one you have. And remember, those Medicare Advantage plans, you can change every year. And some people can change it multiple times a year. If you have Medicaid, you can change your plan every 3 months. I think they're going to be changing that possibly in the future, making it easier. So if, the Medicare Advantage plans, people will say, hey, that's a great plan at zero premium, and they're giving me, Barbara says hearing aids, or they're, giving me dental. They're not giving you anything. These, insurance companies are, in it for a profit. All insurance companies, Medicare Supplement, Medicare Advantage, all of them. And you say, well, zero premium. This is money. This is your money. You think of it this way. You paid into FICA, Federal Insurance Contributions Act. It's insurance, government insurance. You paid into that for decades. A lot of money. Out of every paycheck you paid FICA, part of that went to Medicare. So you paid. So your money, all those thousands, tens of thousands, hundreds of thousands of dollars are sitting in a bank in Washington, D.C., or Fort Knox, or wherever, I don't know. They're sitting in a bank. And that's your money. That's your Medicare money. And then you go sign up for a Medicare Advantage plan, and then that Medicare Advantage plan goes to Washington and says, hey, we just signed up Barbara, give us that money. So that's your money. So think of it that way. So when you get those benefits, when you sign up for a plan, please look at all the details and use all of the benefits. If you've got dental, use the dental because all those plans are only good for 1 year. Medicare Advantage plans are only good for 1 year. Medicare supplements, once you sign up for them, you're done. You don't have to do anything for the rest of your life, except for, check, the Part D part. But Medicare Advantage, those expire every year. So if you don't do anything, it just, restarts. But make sure you get all the benefits you can before December 31st, Cinderella, whatever. And because if you have, let's say, $5,000 of a dental, then use it by December 31st, because that $5,000 is going to go away. Next year, January 1st, if you have the same plan and nothing has changed, which a lot of times stuff changes, a lot of competition out there, so it's always good to check those plans every year. January 1st, you check again and another $5,000. So that's what I usually recommend is when people have a lot of dental or whatever, it's usually dental, is towards the end of the year, and the dentist says, okay, yeah, we've got, it's going to $10,000 to do X, Y, or Z. And they're like, well, I've only got 5,000. Well, do the 5,000 before December 31st, and then tell the dentist, let's do the other 5,000 after January 1st when the new money comes in. And the dentist, before you finish the sentence, they'll know exactly what you're talking about. So yes, that is your money. That's not the insurance company's money. That is your money. So get it, please. Don't let it go away. That's your money sitting there. All right, let's see. Dun, dun, dun. All right, what else? Thank you for being available. Cyber, if a person were lucky enough to make money off of a YouTube videos and they approach it as a hobby, would that affect Social Security disability? Well, Social Security disability insurance. I think it's the same question. Are you the same guy? Yeah, I was going to start a YouTube channel. Yeah, well, 90, most people don't make money on YouTube, including my, self, really. But anyway, um, yes, if you're receiving SSDI, that is a disability, so that could affect. So it really depends how you're doing it, and how much you're making. So there's the substantial gainful activity if you make over that amount, and so always notify Social Security if you start doing YouTube, and it's going to take many months to get monetized, and then yes, so please, once you start making money, then you have to notify Social Security. Cat J, hello, Dr. Ed. I am 61 and on SSDI. Can my wife claim against my SSDI when she is 62, or just her work record? Well, she'll have to do both. So she'll have to file for benefits on her own record. And then if yours is twice as much as her benefit amount, her PIA, primary insurance amount, which is basically what your benefit is at your full retirement age, if yours is twice as much, then she can collect benefits on yours as well. So, but she has to file on her own first. Michael, are any of the senior assistance programs, food programs, real, or are they frauds? Yeah, blanket statement that I'm sure some of them out there, you read, even the big ones that we all know that are, been around forever. You look at there's a website that gives kind of that. There's admin costs that, for every dollar you contribute to whatever organization, like 99% goes to, the CEO and, management, and 1% goes to the actual charity. So yeah, that's unfortunate. So whenever you donate, make sure you check that website and you find out how much, actually goes to where you think it's going. But Michael, hopefully you checked out my series of videos. I did 4 series of videos on how to live on Social Security alone. I know it's a stupid title, but that's what you got to do for YouTube. So yeah, check out, and there's 48 different programs and things out there that hopefully will make your life easier. So yeah, and again, I apologize for the slow, boring introduction in the first video. Everybody's complained about that, and I got the message. I'll make my introductions more quicker. Let's see. So much Medicare fraud. Yes, I agree. There's all kinds of. Let me see. Can you have an Advantage plan for a few years, then change to a supplement plan? Absolutely. But if you don't have an enrollment period, like you had health insurance, and then from work, and then you didn't, or you moved, or whatever the case may be, then you can switch, but you'll have to go through medical underwriting. So, you don't necessarily always have to have a physical or anything like that. It's usually just whoever's helping you sign up, they ask you like a dozen questions. And if you answer no to them, then that's the medical underwriting. So yes, you can switch, and that's a good thing to do. If you're in a Medicare Advantage and you're still healthy, and then you say, oh, maybe I should have signed up for a Medicare supplement plan, and you're still healthy, yes, do it before you are no longer healthy, because once you get sick or something like that, then it's going to be very difficult, if not impossible, to switch to a Medicare supplement plan. So it's very important to do it immediately, if not sooner. And again, if you don't have someone to help you, reach out to us. You can email me at ed@mygovexpert.com, and just tell me your name, your phone number, what state you live in, because they're all state specific, and tell me what you're looking for, and I'll have one of our network partners reach out to you and help you out. And again, full disclosure, our network partners support our mission here. All right, William, I want to file for survivor benefits next year when I turn 60. I want to apply using a restricted application. I have a great fear of this not being filed correctly. Um, Second question, how can I be assured the correct restricted filing is done? Not it get complicated. My understanding is that for the application to be restricted, I must answer no to this question. Yeah, it's pretty easy. So if you're just going to go in there and file for survivor benefits and you don't want to touch your own, I guess that's probably what you mean by restricted. So yeah, that's easy, no problem. Yeah, those are very, very easy. I've done a few 100,000 of those. So you just yeah, you just tell, obviously it sounds like you already know your numbers and how much it would be on your own record and how much it would be as a survivor. So you want to go ahead and do the survivor benefits, and you just tell them, I want to file for survivor. I do not want to touch my own. I want my own to increase until I'm full retirement age, or 70, and then switch over at that time. Yep, no problem. It's super, super simple. They won't mess that up. Barbara, I have a United Healthcare dual complete plan. Thank you so much. I have done that. Oh, okay, yeah. The dual plans, those are yeah, those have quite a few extra benefits, because the dual plan means that you have Medicare and Medicaid. So basically, you've got so many different places, trying helping with your healthcare. So, which is a beautiful thing. I wish it would be easier, but you've got Medicare helping you with your healthcare. You got Medicaid helping with your healthcare. You have United Healthcare. You've got the Part D, and you also have the extra help with your prescription drugs. They're helping you with your healthcare. So yeah, so you've got a lot of different organizations, helping you with your healthcare, and so that's always a beautiful thing. I'm sure it was a nightmare getting all that stuff, but now that you've got it, it's awesome. I thought hobbies were exempt. No, no, any type of income coming in. Yeah, because anybody could say, "Oh yeah, I'm a mechanic, but I'm shade tree mechanic, but it's just a hobby, but I make $10,000 a month." So yeah, yeah, it doesn't matter whether it's the hobbies or your profession, or to keep you bored, to keep you from getting bored in semi-retirement like me. Yeah, if income coming in, then it will, yeah. But again, it has to go over substantial gainful activity. Are COLAs keeping up with inflation, keeping pace? I don't think so. I think COLAs should have been about 2%, at least 2% more every year. Like it was 3% this year. I think it should have been 5. Last year was 8, which was pretty good, but I still think it should have been around 10. They were talking about 10, then they went back to 8. So I believe they should be, over the last 20, 25 years, I think they should have been 2% more. But yeah, when I am voted in the enlightened dictator of America, I will change that right after I come up with a cure for male pattern baldness. Application. Do you wish this application to be considered an application for retirement benefits on your own earnings record? Then you would say absolutely no to that. You do not want. Again, you cannot do survivor benefits online, so you actually have to talk to a human being. So survivor benefits you can't do online. So there's that. Because the SSDI was based on employment, but again, Social Security considered any type of income. Again, so there's earned income and unearned income. So if you made a record 20 years ago and you're getting royalties, that's unearned income. But it's still counted for SSI, not necessarily probably SSDI. Wish me luck. I sent off my CDR review. Thank you for a lot of your help. Yeah, you're welcome. Thank you. Thank you. Yeah, hopefully they don't do anything and they say, okay, we'll see you in the next 4, 5, 6 years or whatever. Let's see here. Do you know anything about SSI and how it works? Because I have SSI and I asked him questions and I don't really want to answer them, so we're going to get information about it. Yeah, SSI is the welfare-based program you can get based on disability or being what Social Security calls aged, 65 or older. So yes. So there's, you have to have limited income and limited resources. And you can't have, so basically it means you're not insured for Social Security. You didn't pay into Social Security enough, and therefore that's why they're looking at the SSI, welfare-based program. Is there a difference between SSD and SSDI? Yeah, so yeah, that's basically, you probably mean SSI, yeah. SSI is the welfare-based benefits, and then SSDI is what you actually pay into it. Does anybody get anything from your FERS if you die? Yes, if you pay into it. FERS is the Federal Employee Retirement System. If you pay, when you're collecting FERS, if you pay 10% every month, then your surviving spouse will get 50% of what you're receiving. If you don't, then they won't. I think if you pay 5%, it's 25. Yeah, don't quote me on that. But yes, you have to set it up like that. Let's see, TikTok. I drew on my Social Security at age 62, and my husband was already drawing his Social Security. Did they check and make sure? If your husband's benefit amount is over twice as much as yours, then you're probably entitled to some benefits as a spouse. So it doesn't hurt to check, because there's, again, the full benefit amount. So if you're receiving reduced and he was receiving reduced or full or something like that, it might be a little confusing. So it's a good idea to just call Social Security, the 800 number, sit on hold for 3 hours, unfortunately, and just have you and him sitting right next to each other, and then say, hey, is there any money left? And if there is, they'll set you up an appointment. Difference between Advantage plans versus supplements. Yeah, just go ahead and rewind. On TikTok, I can't, for some reason, the live things, once they're live, they disappear. So go to my YouTube channel after I finish this live, then you can go to my YouTube channel and you can watch it, and I talk about Medicare supplements and Advantage, but I also have some other videos as well. So go to my YouTube channel. I've got close to 300, probably over 300 videos there. And yeah, I've got a bunch of ones on the difference between Advantage and supplements and all that kind of good stuff. Mark Fox, the way it's going, SSI will be depleted in less than 20 years. Thanks. Okay, yeah, SSI, that's incorrect, because SSI comes out of general revenue. SSI does not come out of the Social Security Trust Fund, the Title II Trust Fund. So yeah. What do you think about the New York Times article written about you? I didn't know there was a New York Times article written about me. Was there? I don't think so. Was there an article written about me? I cut off my question. Okay, let's see. Vicky, about she was a clergy, and yeah, no. If I won't read the whole question because the answer will include the question. Yeah, if you're receiving even $5 on your own record, then you're entitled to Medicare once you turn 65. If you're not entitled to any money on your own record and you're entitled to benefits on a spouse, then same thing. You're still entitled. You just have to be entitled to benefits. So you'll still get Medicare. All right, political stuff. I'm going to delete that. Let's see, Glenn, I'm gonna, all right, so I meant to be on here for about 30 minutes and it's already 54, so I'm gonna take one or two more questions and then we're gonna call it a day. Glenn, 55 on DWIB, Disabled Widows Benefits, didn't get approved for 3 years, wow, yeah. Spent big money on Cobra during that time. After approved was allowed Medicare. I was paying for all Medicare for 3 years. Can I get reimbursed? No, unfortunately. Yeah, you can, if they backdate your Medicare for like a year or something, then, that's a possibility. But yeah, it doesn't sound with the timing. With my SSDI, I am 61. I have Medicare Part A and B and also TRICARE for life. Do I have to get the Part D at 65? I would call TRICARE. They change, their policy, with Part D. If you don't get it at 65 or when you're supposed to get it, then yeah, there's a penalty for that too. But yeah, people with TRICARE, sometimes they do, sometimes they don't. I would call TRICARE and say, are y'all gonna, am I gonna have TRICARE forever and ever and ever? And then they say yes, then do I need to sign up for Part D? Because sometimes what it is, and this may change, it changed with the post office. Federal agencies are always trying to move cost over onto other federal agencies to show, how awesome they are and, whatever. So TRICARE for life might say, oh yeah, you don't need Part D now. And then 2 years from now, they'll say, oh yeah, we can save a lot of money by forcing people to sign up for Part D. So we'll make you sign up for Part D. So there's that. All right, let's see. Okay, so my friend can't make videos about the homeless elderly for fear she will lose her SSD. Yeah, I would do it because, yeah, again, I think, was it Mr. Beast just did a video on this. He's like the #1 YouTuber or something. And yeah, he says, all these people quitting their jobs and trying to be YouTubers. I doubt, I mean, it could be a fluke, It's like the guy at the Grand Ole Opry's telling Elvis he couldn't sing. Could be a fluke and she'd make millions of dollars making videos about homeless, but then she's making $1 million about homeless, so it doesn't need disability anymore. So if she's really looking to make a ton of money on YouTube, then go for it, make a lot more money than disability. So, but then there's reality. I hate to, yeah. All right, I think that'll do it. I spent a lot longer than I intended, but some great questions. All right, so I have a regularly scheduled live tomorrow. I'll talk about a particular topic about the some surprising things covered by Medicare, and then I'll do a Q&A after. So if I didn't answer your question, I apologize, but be another chance tomorrow, and I pop up every now and then, so make sure you subscribe and share and like and all that kind of awesome stuff, and you all have an awesome day. Take care. Bye-bye.